First question. In the diagnostic statement, excess fluid volume related to decreased venous return as manifested by lower extremity edema. The etiology of the problem is option A. Idiopathic, option B. Excess fluid volume, option C. Edema, option D. Decreased venous return. And the answer is option D. Decreased venous return. It's a simple question. Everyone can answer it by question itself. Then question number 2. The main cause of migraine is option A. Dilution of cerebral artery, option B. Face and neck muscle weakness, option C. Emotional instability, option D. Infection and inflammation of sinus opening. And the answer is option C. Emotional instability. Migraine is a familial disorder marked by severe, painful, periodic, unilateral, pulsatile headache that begins in childhood or early adult life. Exact cause of migraine is unknown, but some factors which triggers migraine are allergic reaction, environmental stimulation, physical or emotional stress, change in sleep pattern, foods containing thiamine, and smoking. And the question number 3 is collection of pus in pleural cavity is option A. Emphysema, option B. Empyema, option C. Pleural effusion, option D. Hemothorax. And the answer is option B. Empyema. Empyema is collection of pus inside the thoracic cavity. Emphysema is a chronic obstructive pulmonary disease. In this, air is trapping inside the alveoli and it interferes with the oxygen exchange, leads to respiratory difficulty. Next, pleural effusion is the accumulation of fluid in the pleural space. Next, hemothorax is the accumulation of blood in pleural space. Question number 4. Which of the following not a role of a nurse? Option A. Prescribing medicines, option B. Caregiver, option C. Communication, and option D. Counseling. And the answer is option A. Prescribing medicines. Prescribing medicine is a responsibility of a consultant, and our responsibility is only to carry out that orders. And also much more responsibility is also there as coordinator, communicator, teacher, counselor, manager, leader, motivator, delegator, clinical thinker, researcher, advocator, evaluator, and much more. And the question number 5. Among which of the following the task doesn't require a registered nurse but can be delegated to the health nurse assistant is option A. Assessing wound healing process, option B. Adjusting oxygen flow, option C. Teaching the client about medicines, option D. Feeding and bathing. And the answer is option D. Feeding and bathing. Vitals monitoring, bathing, brushing, nail care, hair care, positioning of patients, helping the patient for feeding, toileting like basic procedures can be delegated to nursing assistant or health nursing assistants.